Good evening and welcome to Hello It's Us, a program that tries to show everyone how we're one big group, we're not trying to survive as individuals. Tonight with my co-host Keith Ruff, we continue on with our shows on epilepsy. Try to cough at the same time. We have with us from the Epilepsy Foundation of Iowa, Roxanne Cogil. Cogil, God, well, I was close. Most of the names. And returning from our first show, and I don't remember your names either. You can introduce yourself again?
Sure, no problem. I am Dr. Charuta Joshi. I am an associate professor at the University of Iowa and director of pediatric epilepsy.
And I'm Mark Granner of the University of Iowa Department of Neurology, professor of neurology and director of the Inpatient Epilepsy Monitoring Unit and co-director of the Comprehensive Epilepsy Program.
And of course, my co-host, Mr. Keith Ruff.
Thank you.
Roxanne, you want to kind of explain what the Epilepsy Foundation of Iowa does?
Sure. The Epilepsy Foundation provides support and services to individuals and families living with epilepsy across the state of Iowa. We offer one-on-one client assistance for individuals and families. They call in asking for help and support and guidance for, it could be for employment, transportation, IEP, school health care plans, all sorts of challenges that they're facing, and we help direct them towards resources to help improve their quality of life and to help them overcome those challenges. We also lead support groups throughout the state. We have support groups in the Quad Cities, Cedar Rapids, Iowa City, Ames, Des Moines, Sioux City, and the Omaha Council Bluffs area. We have featured speakers at the support groups, and the members that come to the support groups, they have different topics or concerns that they're dealing with, so we line up speakers to address those challenges so they can continue to learn and access a variety of resources across the state. The Epilepsy Foundation provides a lot of advocacy across the state, and we have a consultant that we work with to work on patient safety issues, eliminating barriers to access to care with their medications, as well as supporting training programs across the state, trying to get different training programs in place. We offer free seizure trainings on seizure recognition, first aid, and safety, and we have specially designed curriculum to teach school personnel, school nurses, law enforcement, first responders, and we can customize our trainings to civic and community groups, group homes, you name it. But education is the number one thing that we try to do across the state, so people know how to properly recognize when a seizure occurs and what to do if that happens.
Okay. And I know one of the big events that you've got coming up shortly is the Iowa Seizure Smart Conference. You want to share some of that with us?
Yes. We received a grant through the Epilepsy Foundation through Project Access. It's a children and families grant, which has enabled us to host an Iowa Seizure Smart Conference. And this conference is designed for the entire state of Iowa to educate individuals, families, caregivers, professionals on all the different treatment options that are available in our state for people living with epilepsy, such as medication, the newer medication treatments, epilepsy surgery. Also, the vagus nerve stimulator is an option for some folks, as well as the ketogenic diet for the younger population of people. And what we hope to do is to educate people, to better inform them of how to get better control of their epilepsy and access resources to help basically improve their quality of life. And I got involved with the Epilepsy Foundation through my daughter. My daughter was diagnosed with epilepsy at the age of 2, and she was quickly diagnosed over the course of a few months with intractable epilepsy, which led to a major brain surgery, a right hemispherectomy. And she's been seizure-free for 4 years now, and she's been my inspiration and passion for wanting to help other people across the state to access these resources, which are so hard to find and navigate on your own, and to help to keep continuing to provide hope for these families for complete seizure control, and to not give up searching for a variety of treatment options.
Are there any programs in the employers because I hear a lot of people with these seizures are let go if they have one on the job. So what is being done to educate the employer?
So what is being done to educate employers when
Yes.
people have seizures?
Yes.
Yeah, that's a very challenging subject. We've been working with Disability Rights Iowa. We've had meetings with Goodwill, with Optime, with a variety of employment groups. We've had Candeo speak at one of our support groups. And that is a process we're continually to work on, is to educate employers so we can get the proper accommodations put in place for when somebody has a seizure, if they choose to disclose that disability in the workforce, and to help keep them employed and safe at the same time. So we'll be talking a little bit about that at the conference.
Okay.
The conference is going to be held on Saturday, March 2nd. And it's going to be here in Iowa City at the Medical Education and Research Facility on the University of Iowa campus. Again, it's being sponsored by the Epilepsy Foundation, but hosted by the University of Iowa Healthcare. We're going to have a free children's educational program. We have the Iowa Children's Museum lined up to provide a full, fun-filled educational day while the parents are listening in on the main conference. They're looking at a half day of art, a half day of science, but they're going to have a great program for the children. We have the Olive Garden in Coralville is donating all the food for lunch. They're donating hot lasagna, spaghetti, salad, breadsticks, and everything, so we're very excited about that. And because of the grant funding for this Iowa Seizure Smart Conference, this event will be free for everybody to attend, a free event for people to attend to get educated and learn more about seizure recognition and safety and all the treatment options that are available here in Iowa.
That sounds terrific. And who are some of the speakers going to be, and what are they going to be talking about?
Well, we have 4 speakers lined up. We have Dr. Mark Granner here, the director of the Department of Neurology, and he's going to talk about treatment options with epilepsy, as well as EEGs and MRIs. Dr. Joshi, the director of pediatric epilepsy, is going to talk about seizure recognition, first aid, and safety. And then we have Dr. Mark Howard, the professor and head of neurosurgery, is going to talk about neurosurgery options, as well as the sudden unexplained death in epilepsy. And we have Dr. Page, an epileptologist in the Department of Neurology, is going to speak about the demographics and the prevalence of epilepsy across the nation and in Iowa. I will let Dr. Granner and Dr. Joshi expand a little bit more of what they're going to be talking and educating the crowd about at the conference.
Yeah. Thanks for the invitation to the program, Roxanne. I think it's a fantastic program because it's so broad, and it covers so many of the important topics that might be on people's minds. I get to talk about sort of entry into the system, diagnosis, how we figure it out, how we start treating it, medications, when we might move beyond medications, some of the specialized testing that goes into other treatment options like the vagus nerve stimulator and brain surgery for seizures, and sort of pass the baton to Dr. Howard, who does the surgery himself. We can talk about some of the features of our inpatient epilepsy monitoring unit, where we do these very specialized diagnostic testing things, and also talk a little bit about an upcoming development that we're working on right now in collaboration with our Department of Psychiatry and our Department of Neurosurgery. We're the 3 brain doctor groups, along with pediatric neurology too. I guess 4 brain doctors. You're one of us, though. You're a neurologist. So there are these people that work on the brain, and we're putting together a series of multidisciplinary clinics. The purpose of a multidisciplinary clinic is to gather a group of care providers together so that a patient can come to one place on one day and see everybody they need to see that day. So on a given day in our, let's say in our drug-resistant epilepsy clinic, it might be seeing the epilepsy specialist neurologist and seeing the neurosurgeon. In another clinic devoted to ALS or other neuromuscular conditions, it might be the neuromuscular specialist plus the physical therapist plus some other people. So this will be a brand new space. and a brand new concept of putting care together where a patient can come in and see a number of different people. It'll be a pretty full day. We'll tell them that they're going to be there for a little while, but it'll, especially in a state like Iowa where people often have to travel from Sioux City or Quad Cities or different corners of the state, this will be a way to avoid a lot of travel. People come here once, much more convenient for the patients, and we can help plug them into services in one visit, and then also track them, help them, follow them as they come back to clinic. So we'll talk about that in the conference too. In one of the talks, I'm sure we'll talk a little bit about first aid, and it's important in the community to recognize that there's some basic principles of first aid, but one of the key things is you don't have to try to do too much. You just have to make sure that the person stays safe throughout the course of their seizure. It might be necessary to help them down and roll them to their side, for example, so in case they vomit, it doesn't go back down the lungs. You don't want to put anything into a person's mouth because you can cause more trauma to either your fingers or the person's mouth by trying to do that. Loosen tight clothing, take away any hot or sharp objects if they happen to be in a kitchen, for example, and just let the seizure safely take place. We know from experience that the vast majority of seizures are over with within 2 minutes. So they usually aren't very long things. There might be a period of confusion after that where you don't want to restrain or try to hold the person back, but just let them come out of it. Walk it off, walk around if they're in a safe place. Of course, not walking out into traffic or something like that, but letting the person recover from the seizure, reassuring them, letting them know where they are as you can reorient them to their surroundings.
I noticed some of them go into a very deep sleep.
Yes, especially after a convulsive sort of seizure, a person might sleep for quite a while afterwards. But sometimes we see people that get very disoriented or confused. Sometimes they may want to walk. Sometimes they may even, not meaning to do so, but may swing or sort of appear violent, but they really aren't. It's not that kind of purposeful sort of thing. So it's knowing the individual. It's a little bit tougher when you're downtown and don't know the person. Safety comes first, but the more familiar you are with the person, your friends and family members can help with this a lot. And the key thing is to let it happen, keep the person safe, and then help them as they come out of it. And then Dr. Joshi is going to talk about some pediatric topics at the conference.
Absolutely, and I will. I really think it's a great idea to educate the masses, and I think it's a fantastic venue. I will be talking about seizure recognition, and I think we all, despite having seen so many types of seizures in our epilepsy monitoring unit, there are multiple times that we are sometimes not sure about if what the patient is doing are indeed seizures or not. So it would be even harder for families to recognize what seizures are. Especially in pediatrics, they can be very subtle, and sometimes the only manifestation of a seizure could be when somebody suddenly stops breathing and turns blue. But there is never any shaking visible to the families, and that's extremely scary to families. So what can a parent do at that time, or what can family members do at that time, would be something that I would discuss. I would also discuss different ways of being able to give medication till help arrives, and there are a couple things that we do differently on the pediatric side and also in general. So seizure recognition, safety, first aid, just as Dr. Granner said, would be a little bit of what I would touch on during the talk.
Besides looking at somebody's eyes, what other signs can we look for before somebody goes into a seizure? A good friend of mine that's a co-worker, I can tell by his eyes.
The more you're around somebody, the more you might detect real subtle clues like that. Some people get a warning before their seizure, so they can tell us. I have my feeling. It's what's called the aura, the beginning of the seizure. So they might be able to tell us that that's going on. Sometimes they don't get that, though, and they become unaware and unable to respond. It may be a look in the eyes. It may be some movement of the mouth, like a chewing motion. It may be picking with the hands, reaching, turning the body. It's really a lot of different manifestations. Not in a single person. A single person may have a sort of pattern that their seizure looks like, but if you if you asked 1,000 different people, they would give you 1,000 different descriptions about what their seizure feels like to them, because it's a very personal experience to them. And people have written very eloquently about what it feels like to them. They've drawn pictures about what it appears to be like when they're having a seizure, and they're all very different.
And sometimes a person knows it's coming, but they cannot put into words what it is that they know. And many patients will tell me it's just a feeling that they cannot describe. But the look on the face changes, and their loved ones would sometimes know that this is the kind of look that the person gets, or they stop mid-sentence or continue automatic behavior. There was a patient of mine that continued to shuffle cards and continued on for a long time, and that was just an automatic thing that happened while they started and went through their seizure. So sometimes it's tricky.
The friends and family members and the people close to the individual will know better than anybody else. And that's an important point when somebody comes into clinic for the first time. If we're seeing just the person and they're trying to describe to us what they're having, it may be very challenging. It may be difficult to get a complete story. So it's really important if somebody can come along with a friend or family member who's seen them have their seizures. We'll like to ask them questions about what they're seeing too. That helps a lot.
Or even have the friend or family member take a short video clip with their smartphone. A lot of doctors appreciate that.
Yeah.
Another method for keeping track of seizures is to go on to seizuretracker.com, and you can keep track of your seizures electronically, quickly and efficiently as well.
I know there's been some luck with service dogs being able to recognize when a seizure is going to happen and get somebody down, whatever. Is that very common, or is that a fairly small number? I have no idea how many people are really utilizing service animals.
Yeah,
for
I have a handful of patients who have a service dog. I think they sort of fall into two categories. There are a larger group of dogs that can be trained, and they most often have to be specially trained. There are places that do this. Trained to respond to seizures. So these are seizure response dogs. So when they notice their owner having a seizure, they would help guide them out of the intersection in the street or help them in their home. There may be a small group of dogs that can recognize the very beginning of a seizure. And we talked about these clues of how somebody looks in the eyes. Maybe dogs can even intuitively tell that before a human can. And so there are people that claim that they're seizure prediction dogs. I don't know if there's a science behind that or how exactly that might happen, but I do have some patients who've developed a very close bond with their dog so that they can almost tell right in the moments before they go into a seizure that something's going to happen.
And I have just, sorry.
There's a little problem in Johnson County because when the responders respond to a seizure, and if there's a dog, they won't take the animal.
I've heard that.
They'll take the patient, but not the animal.
Right. And medically, our point is that the two of them are one. You know, they belong together. Separating the patient from the dog can be very harmful to the relationship.
Is there anything being done about that?
I don't know, on the EFA.
Well,
side of
technically, it's the law. It can go wherever the patient goes, but if the patient is unconscious from a seizure, that presents a big challenge.
I've written letters to try to help preserve that connection between the dog and owner on public transportation like the bus, and our seizure specialist nurse has worked with the first responders, the EMTs, on a lot of different issues, including things like that. So it's like a lot of the things we're touching on, it comes down to education and awareness.
Education.
Yeah. I would think some kind of a logo or badge or something on the dog's vest stating that I'm a service animal, take me with you.
They do have that, yeah.
Do they have that on?
Yeah. And they still won't take them. And
Well, we'll keep trying to educate.
Another war to fight.
yeah.
Another thing we're going to have at our conference, in addition to the speakers, we have a section built into the agenda on patient testimonials. And we're going to have 6 different individuals or families come up and share with the group about their case of intractable epilepsy and a type of treatment option that ended up working for them in getting control or near control of their seizures. We're going to have somebody speak about the ketogenic diet on how that helped control their intractable epilepsy. We're going to have somebody about the vagus nerve stimulator on how that helped get control of their epilepsy or reduction of their seizures with their epilepsy. We're going to have, I believe, an individual sharing about their hemispherectomy brain surgery, which is a brain surgery the university is starting to perform, as well as a temporal lobe epilepsy surgery, and a newer medication, I believe, testimonial on an intractable epilepsy patient, and another type of brain surgery as well.
Okay, several times the group has mentioned some nerve stimulator.
Yeah.
You gotta explain that a little bit.
Okay, so yeah, we're talking about the vagus nerve stimulator, which is basically a pacemaker-sized device that, just like a pacemaker, is put under the skin of the left side of the upper chest. So it takes a skin operation to put it in. This is not a brain operation. It doesn't carry the same kind of risks as that does. And a wire is sent underneath the skin to the vagus nerve, which is a large nerve in the neck that carries a lot of nerve input up into the brain stem, the base of the brain, and in particular to a part of the brain that then has connections with lots of other brain areas. So we know that by stimulating the vagus nerve, these electrical impulses can be passed into the brain. We don't know exactly how it works once it gets into the brain, but it was shown in a study about, 15, 17 years ago now, to be effective compared to not stimulating. So they put the device in, they turned it on for some of the people, didn't turn it on for others, and did a study and found that it worked. It works at reducing seizures. It's a pretty good device at cutting seizures down. It will occasionally produce seizure freedom, but that's only about maybe 5 to 10% of the time in my experience. So it's not a cure, it's not a complete way of controlling seizures, but I think when people come to that decision is when they're sort of tired of trying one medicine after another, and the sort of side effects that come with putting 2 medicines together or 3 medicines together. We would like to evaluate folks for that sort of the same way we do for surgery. We like to check an MRI scan to look at the brain, a picture of the brain. We like to record some of their seizures on the video AG to make sure that we know what type we're dealing with, and to see if they might actually be a better candidate with a higher chance of seizure freedom by having brain surgery. Now, some people just don't want that, it's natural that some people wouldn't want to have their brain operated on and run that kind of risk. But so the VNS serves as an option, sort of between medication and between resection brain surgery. In my adult clinic, I have about 80 patients that have this in right now. Children also have it too.
Absolutely, and I think sometimes the chest size of the child becomes a limitation, but we have been putting devices into patients that are as young as 2, 3 years old. The good thing is that the parent doesn't have to run after the child to feed them the yucky tasting medicine, large tablets 2-3 times a day. The other thing is the risk of sedation is much less because this is not sedating the kid. And sometimes parents feel empowered because although at times this does not work, but they feel empowered with the ability to swipe the magnet at the beginning of the seizure. I think it works in about 25% where it may cut the seizure short if the parent notices that the child is going to have the seizure, and I don't know if that's been your experience.
That happens in adults too. Very many notice that when they swipe the magnet, the function of swiping the magnet is to turn the device on right then at that moment, so it's an on-demand kind of function to it. The device also works by itself. It's on an automatic cycle, so you don't have to worry about it. It's on for a while, off for a while, on, off, all day, all night long. But some people do report that when they use the magnet or a family member uses the magnet, it may shorten the seizure, make it less severe, or sometimes, in a few cases, just stop it right there in its tracks. And you're right, with adults, it's also seems to be sort of an empowering device, especially after they've been on a number of medicines and dealt with the problems that come from taking medicine of sleepiness and balance and dizziness and memory problems. People tend to like this, and even if it doesn't make them completely seizure-free, when the battery will naturally wear out at a certain length of time, and many people it lasts 7, 8, 9, 10 years, with others maybe as short as 2 years if we have to turn the settings up very high. But when it does wear out, most of them choose to have it put in again because they like what it does for them.
And it's not a major operation.
No, it's basically a skin operation, just right here. There's one incision at the upper chest, and there's one at about the collar line here that can be pretty well hidden by clothing.
Yeah.
And it's not a very disfiguring operation either. It's the size of the generator is slightly larger than a small matchbox, I would say. It's much thinner than a matchbox, and you could even wear a tank top and not have it show too much.
So all these treatment options are going to be talked about and presented on at the Iowa Seizure Conference, and again, that's on March 2nd. We're going to start it at 9:30 or 8:30 a.m. is registration, and it'll conclude at 3. But you can register for the conference at www.epilepsyheartland.org. Again, that's www.epilepsyheartland.org. And feel free to call me at the Epilepsy Foundation Iowa office. My number is 515-238-7660. Again, that's 515-238-7660.
Thank you all for coming. It's been a pleasure and very informative.
Yeah.
We'll see you next week. Goodbye, it's us.